about a year and a half ago.
Yeah.
I had extreme pain where I couldn't exercise, I couldn't bend over to tie my shoe, I couldn't put on my sock in the morning. And I had extreme, what I thought was groin pain. So I thought I might have pulled a groin muscle.
Wow.
So I went to my general practitioner, and the first thing I told him was, I got this screaming pain in my groin, and he goes, I think you have arthritis, an arthritic hip. I said, really? So he got me a x-ray, and I went ahead and got an x-ray. And sure enough, it showed that I had an arthritic hip from my middle of my spine over, and that the cartilage was deteriorating. So that the next thing they wanted me to do is to go through some therapy, but at the same time I'm thinking therapy, I'm just putting more pressure on my hip. So that's when I contacted,
VivaTech.
you and Dr. Mike told me, hey, we've got this procedure, stem cell. We've been talking about it every year, right?
Yeah.
And I said, I got to do it because I'm in too much pain. When you can't tie your shoe and you can't put on a sock every morning and it's painful, I needed another solution. So that made me get a hold of you guys. You guys got me in touch with Dr. Ladico, got an MRI. Then the whole procedure took place. Within 2 days of receiving the injection, I was able to bend over and put on socks and tie my shoes without any pain, lift my leg up over an inch off the floor, which I wasn't able to do. So I'm walking pretty good like we discussed, and my gait is coming back. It's just now a thing that I haven't used my left leg properly in a year and a half, so I think most of that's going to be tissue and muscle and getting the right walking steps down because I was favoring it so much.
Yeah.
I mean, people would always say, hey, did you just get a new hip? And a new hip wasn't a choice because my hip was too good.
Right.
You know, they didn't want to do surgery and put a new hip, and neither did I. Just I feel it's too young. So in a nutshell, that's what the last year and a half has been. So best thing I've ever done for my health. So hopefully I can.
So you would recommend it to others?
I definitely recommend it to others. It is immediate pain relief for me, and the technology is phenomenal. Plus, you're using your own cells. You're not using drug that somebody made. All right, you're using your own body and and the healing properties of the stem cell.
Yeah. Maybe you should just stand over there and.
What?
I mean, I know that you've demonstrated how flexible you are now, or how you can move, where before you really couldn't.
Before I couldn't even bring my foot up here. Now I can do
Wow.
this. I can swing either way.
That's
on my
excellent.
hip. And I can bend over, tie my shoe.
Very good.
I got the full mobility that I've had prior to the me getting probably arthritis.
Mm-hmm.
So, I mean, has it changed my life? Yeah. At least I can move around and walk, and obviously I'm heavily involved in baseball and be able to go through a batting practice, hit ground balls, pick up balls off the ground.
Right. And how old are you?
I'll be 56.
56. How long was that nagging hip problems taking place before you actually found out what it was?
It was probably gradually going over the years, and sometimes you just think you're getting old. But I think in the last year and a half is when I couldn't bend over. Or if I bent over, it took me about a half an hour to bend over, and I had to mentally get prepared because I know it was going to hurt. And the pain was excruciating. So you figure out, how do I bend over to pick up this? If something falls on the ground, sometimes I had people pick it up for me. You know?
Were you using anything? So as you had that pain, what were you doing about it?
I would eat Advil, and that wasn't a choice. So I had to make sure that, you know, if I was going to go do an activity or do work around the house, I would pile up on some Advil, right? And that's not the right thing to do, because at the end of the day, it's going to eat your insides up. So after I do it, I wouldn't take it for a week or a week and a half, because I said, I overdid it here this weekend, so I better not take any Advil. So right away I got back, because it's an inflammation, right? Reduce the inflammation. And so